Alright, my name is Jane Kelly. I'm a student here at the College of Nursing, and today I will be doing a medication administration checkoff. So first things first, we're going to look at my patient's chart and the medical administration record. We are just looking for Jaguar Jones. MR number is 417-6352, 417-6352. He's allergic to penicillin. And for the drug we are giving today is morphine sulfate, 5 milligrams IM every 4 hours, PRN for pain. I'm going to compare this to the medication administration record. And we have morphine sulfate, 5 milligrams IM every 4 hours, PRN for pain. Okay, so now I'm going to do hand hygiene. I'm going to pick my medication from the 4 vials. So I have right here morphine sulfate, 10 milligrams per milliliter. Expiration date is 12/20/2025. Got it. I will be using a 3 milliliter syringe and a blunt tip needle. First, I'm going to clean the hub of my medication. I'm just going to compare one more time that this is morphine sulfate, 10 milligrams a milliliter. Since this has 10 milligrams per milliliter and I only need 5 milligrams, I will be giving a 0.5 milliliter dose. Since I only need 5 milligrams, I'll be giving a 0.5 milliliter dose. I'm going to clean the hub. I'll be using a blunt tip needle, being sure not to touch the hub to contaminate it. Okay, since I'm doing 0.5 milliliters, I'm going to draw that much in air out. I'm going to inject that into my vial. And I'll make sure that I get all the bubbles out. My mom has a home daycare in the back of the house. That is what you are hearing right now. I'm going to verify that that is 0.5 milliliters. Can you see it? Okay, so now I will not be using the blunt tip needle. I'll be using a 23 gauge needle. So I'm going to change that out. So we're going to verify again that I have morphine sulfate, 0.5 milliliters, which is 5 milligrams. IM every 4 hours, PRN for pain, and I'm going to verify my dosage with another nurse. Okay. So it is verified. So now I'm going to write the label for it. So we are doing morphine, we're doing for Jaguar Jones. The first thing I'll put on there is Jaguar Jones. Morphine sulfate. IM 5 milligrams, 0.5 milliliters. I'm going to put that onto my syringe and just verify one more time that this is Jaguar Jones getting morphine sulfate 5 milligrams IM, which is going to be 0.5 milliliters. So now I'm going to take this into my patient's room. I'm going to perform hand hygiene and introduce myself. I'm just going to tell him that I'll be telling him that I will be giving him his pain medication that he asked for. So we'll verify one more time that this is Jaguar Jones, and my number is 417-6352, 417-6352, and he is allergic to penicillin. I'm going to put on my goggles, put my gloves on, and verify one more time that we are giving morphine sulfate 5 milligrams, which is going to be 0.5 milliliters, IM, every 4 hours PRN for pain. Okay, so I'm going to raise his bed to a working height, lower the side rails, uncover the spot that I will be doing the injection, and cleanse the area. Cleansing the area from the center, working outwards, being sure not to recontaminate anything. Going to uncap, pull it taut, dart-like motions at a 90-degree angle. We're going to aspirate for air, aspirate for blood to make sure I'm not in a blood vessel, and then I see that there is no blood, so I'm going to inject slowly. I will remove my needle, place it into the sharps container, and apply pressure, being sure not to massage the area. Okay, so I'm going to cover my patient back up, get them in a comfortable position, lower their bed, raise their side rails, and I'm just going to check to make sure they had no adverse reactions. So now I'm going to take my gloves off, dispose of them, take my goggles off, perform hand hygiene, and I will go out and chart and document that I gave the pain medicine, the morphine sulfate 5 milligrams IM every 4 hours PRN for pain. I will document that I gave that to Jaguar Jones. I will document how the patient took it, and then I will return to the patient's room to check on them and see how they are doing after the administration of the pain medicine.